So we decided to provide bariatric care to adolescents because it's an unmet need in our community. And can you imagine a 15, 16-year-old kid with a parent who has to drive down to Atlanta for monthly visits? That's just not practical for most of our kids and most of the kids in our community.
In our comprehensive program, we have parents that call that maybe are concerned about their child who's struggling with obesity, and we have several different treatment options. They may start just with nutritional counseling with a registered dietitian to begin with. Others may be ready for medical weight loss, which may include some dietary changes, and for some medications, anti-obesity medications that may be appropriate for them. For those that know that surgery is the next step for them, they will meet with the surgeon first, make sure that they're a good candidate for surgery, and then on a monthly basis they'll see our multidisciplinary team, which will include our pediatrician who's over the program, a registered dietitian, a pediatric psychologist, and an athletic trainer, so that we can start working on those lifestyle changes that will benefit them and maximize their weight loss after surgery.
So it's hard enough to be a teen these days. Being a teen and being concerned about your weight is a whole other level of stress for a lot of our kids. So some of the issues that they're dealing with are not being able to engage in normative activities, so not being able to participate in sports if they want to, not being able to participate in clubs, being self-conscious in school. We actually have had teens who have had difficulty being into their desk at school or having a hard time getting from one class to another. So there's a lot of those types of issues. There's also the self-esteem issues. There's the friend issues, the social issues, sometimes feeling like they don't have that support system that other teens may feel. So there's a lot of different impacts that overweight and obesity have on our teens today.
So my goal is, as a pediatrician, to help children be healthy. Healthy, not just treat an immediate illness, treat their disease process, but develop skills, develop lifelong healthy habits so they can grow to be a healthy adult. And this is exactly what this obesity program's goal is as well. Yeah, it's very important to have the family involved because the family is going to be first the role models. They are going to be the ones that are preparing the meals. They're going to be eating together. No one person can do this by themselves. So we want the parents, siblings, grandparents, everyone to be involved.
20 years ago we didn't have this same type of an involved program that we develop now. And I think that because we have such an involved program, these adolescents are going to do much better. So it's a comprehensive program. We're looking to help those kids in our community that just they can't get this help anywhere else, and we're going to make sure that we do it in a way that's going to be successful for them and their families.